I'm Brenda. I work as a physio in trauma and pelvic health, and I currently, sorry, just people coming in. I'm founder of Health Connects, which is a health and wellbeing centre in Port Glenone. So I'm originally from Port Glenone, but now married, living in a Hawkle. You're going to get a wee bit of my life history here. So I'm 35 now and qualified as a physio in 2007. So my specialty was in trauma before I took an interest in pelvic health. And I kind of just took an interest just before my first daughter was born 5 years ago. But anybody that knows me well knows I like to get to the bottom of everything, especially when I'm seeing clients. And my interest really was pushed forward even more to kind of get into the root cause of things and illnesses and everything else. So my husband got diagnosed with MS in 2015. So his medical team were excellent, definitely they were. But the one thing was that no one really mentioned what might have triggered his condition. And no one ever mentioned about looking into the environment or lifestyle factors such as sleep and nutrition. The goal was simply to suppress the symptoms but not explore the root cause. And so around that time I began my research, and I literally did read thousands of articles. That's not a typing error. And we probably have a bookcase of books now on MS. So I like to get to the bottom of pretty much everything. And later that year, my daughter was born then, and she had a congenital health issue, which is another thing to explore. But it definitely was a chaotic few years where I learned a lot, and it probably changed my whole path in my career. When the dust settled, I realized I was kind of setting out to fix them, which is really common for females. I think we kind of look outside ourselves and try to fix everybody else that's around us. But in the last few years and with my work and working on myself mostly, I learned that this is the wrong thing to do. So we only must ever work on ourselves and hope that those around us model the behaviour we would like them to display, such as sleeping well, eating well. Since learned that this is actually a function of the mirror neurons in our brain. So things you might notice is like a child, for example, might walk or make expressions like their parent. And that's exactly what that is. You mirror those around you. So a little quote that kind of demonstrates this is, yesterday I was clever, so I wanted to change the world. Today I'm wise, so I'm changing myself. From watching my daughters, really it was a miraculous recovery, and through my research, I discovered that no one ever really explained to me the enormous healing capacity of the human body when we believe in the impossible and create the healing for the environment for healing. So my daughter's definitely defied all the odds, and she was at death's door more than once. So ill that she wasn't able to eat or even receive nutrition via the peg. At one stage, she was getting fed into the vein in her neck. And her case now, her recovery has been she's completely transformed now that she has no symptoms at all of what's supposed to be a lifelong condition. And both of her vocal cords are actually still paralysed, yet she can talk and has no breathing difficulties even when she runs. My husband has changed his lifestyle too, but in truth, all these things are a journey and there's no end point. So sometimes I'm doing brilliant work and then sometimes it's him. So it's definitely a work in progress. A lot of the times we know what's good for us and feel great when we implement it. But we seem to be the only species in the animal kingdom that when we do something that works for us, we still tend to go back to old habits. So the truth is really that you're more powerful than you've ever been led to believe, and you're definitely the master of your own body. And I think in our current medical system, we tend to give our power away and say, what's wrong with me? I need fixed, when really you've all the capacity to heal yourself, with help, of course. So I'm going to talk a wee bit about pelvic health physio, or pelvic health, physio, and what it involves. And it's quite an underknown area. So it's a specialised area of healthcare that focuses on optimal function of the pelvic floor muscles, bladder, the urinary tract, and bowel, rectum, and sexual function, with a holistic and a mind-body approach to overall wellness. I have a really particular interest in preparation for pregnancy. I think it's a great time for women to become aware of their pelvic health if they haven't done already. And also postpartum, You know, women can have grade 2, grade 3 degree tears and prolapse after having babies. Prolapse being where the walls of the vagina can soften, like a soft tissue injury, into the vaginal canal. If that happened to a sports person or an athlete, they'd be on crutches. You know, if that happened to their ankle, they'd be on crutches and they would be getting rehab for up to 12 weeks, if not 6 months. But currently, women are going home from hospital with 2nd and 3rd degree tears, which are really significant injuries with absolutely no follow-up, apart from maybe a 6-week check with your GP. And at the minute, they aren't happening. So physiotherapists working in this area are called pelvic health physios, and we're based in hospitals and within the NHS. And we treat men and women. So men and women have pelvic floors. We believe in particular that women should be aware of their pelvic health and the impact it can have at different stages in their life. For example, onset of menstrual cycle, pregnancy, postnatal, menopause, after cancer treatment. There is a large focus on childbirth, but actually many women can have pelvic floor issues outside of pregnancy, even if they don't have children. So it's quite common with the onset of menstruation, with the changes in the hormones, and also ladies that are performing quite high intensity sports. So unfortunately, it's a very poorly understood area. I only spoke to a GP last week on the phone who did not know we existed still, but it is getting out there. It definitely is changing, and more people are speaking about this. So the function of the pelvic floor, and I'm going to hold up my wee pelvis now. So these are the muscles of the pelvic floor here. They're like a diamond shape. So we often think of a pelvic floor as being 2D, kind of like a sheet of paper, but it's actually not, it's 3D. So it's kind of like a trampoline. And what it does, and I'm going to talk through the anatomy a wee bit more later on, is it supports the pelvic organs. Pelvic organs being your bladder at the front, your back passage, rectum at the back, and your uterus in the middle, your womb. It's sphincteric, so it supports the sphincter muscles, the sphincters being your urethra, where we pee from, and the back passage, where we poo from. So it prevents incontinence, so leakage of any feces or urine. Also contributes to wind control. And another big thing is that these muscles in this area must relax in to empty these structures appropriately. Another function of the pelvic floor is a pump, sump pump, we sometimes call it, is where it moves lymph and fluids away to remove toxins as required. Stability then, it stabilizes the upper body and the lower body with the core. So we often think of our core as being our tummy muscles, so up here in the front of the belly, or our six-packy muscles, but actually your pelvic floor is your core. So I hope that makes sense, in that when you instead of, sometimes you might have heard drawing your belly button, sit down, squeeze, squeeze if you're about to lift a heavy weight. But actually, if you think of a tube of toothpaste, and I'll use this to demonstrate, if you squeeze in the middle, what you're doing, this is the pelvic floor here, you're putting lots of pressure through your pelvic floor. You're squeezing and putting load down through there that might not be necessary. What you might want to do, instead of just sucking in the belly and squeezing and bracing, is actually, I have to unsqueeze my tube, draw up from the pelvic floor, so draw up from underneath, because those muscles are attached into the deep fibers of the tummy. So we start from the bottom, and there's loads of cues we're to help this. We're going to look at this later on, but different things are thinking about squeezing the back passage, draw up and in. And what will happen is you'll naturally feel your lower tummy muscles working, or hold in urine, hold in pee, draw up a tampon. There's loads of different things, but we're going to talk about that later. So I hope that makes sense, that you don't want to squeeze just the core. Your pelvic floor is your core. So it starts from the bottom and it comes all the way up, and the tummy muscles will naturally engage if you start lower and draw up through the bottom. So what you might think, instead of you're about to lift a heavy weight, is okay, initiate a nice contraction through your pelvic floor, and you'll feel your tummy muscles naturally tighten. But don't worry, we're going to practice this later. Another thing then they're really important for is intimacy and pleasure. The muscles must be able to relax, and an orgasm is actually an automatic contraction of our pelvic floor muscles. So I think language really matters when we're talking about pelvic health and our anatomy. And much of the silence on these topics is due to stigma, which is often rooted in lack of education on our body's anatomy and how they actually work. Poor sex education, and often shame and embarrassment around these topics. We don't tend to use anatomical names to describe the the female body. And this can have a huge knock-on effect. And this stigma has been recognised in the late diagnosis of many gynecological cancers, such as vulvar cancer. There's just a huge stigma out there, and it really is costing women their lives. And this taboo and social embarrassment really is rooted in lack of education. And I'm going to demonstrate that now. I actually can't see my chat box because I'm screen sharing, but I'm going to start with a wee bit of a anatomy lesson now. So if we tip the pelvic floor, this would be a woman lying down, and this would be her bottom half. You're looking up in. So at the tip here we have the clitoral hood, so the clitoris, and then underneath we have the urethra where we urinate from, and then we have the vaginal opening. In between the vaginal opening and the back passage, the anus, is where the perineum is. The perineum is what stretches up to 300% when we give birth vaginally. And if you've had any tears or grazes in this area in the past with childbirth, we'll grade them from 1 to 4. 4 is we tear right through from the vagina to the internal muscle inside the back passage. A grade 3 is just to the edge of those sphincter muscles, well, 50% into them, sorry. And a grade 1 is a graze, and a grade 2 is into the perineal muscles. So basically grade 1 and 2 are either a graze or into the perineum, into the vaginal, these muscles, and grade 3 and 4 involves the back passage. So that's why they're much more severe tears. I personally had a 3rd degree tear with my first child. So I've experienced what that can be like. I'll come back a wee bit on the anatomy in a wee while. So I feel it's really important to get to a place where we're able to say the words vulva and vagina as easily as we say nose and ear. And this is backed up by all child therapists and children education across the world. On average, it takes a woman 7 years to seek help for a pelvic health issue. So I think it's really important that we open up the conversation and know that there are health professionals out there like me who are so passionate and eager to help. So we've got GPs, that's your first point of contact. If you're pregnant, you might talk about any issues you're having with your obstetrician. Pelvic health physio, there's many specialist nurse-led clinics. A vulvar dermatologist. Oh no, don't know how to go back. Oh, do. A vulvar dermatologist is who deals with any skin conditions in the vulva, such as like itching or thrush that won't go away, any rashes, dry skin. Sex therapists with any issues with intercourse. We've got different specialties like gynae, colorectal, and often we can signpost to counsellors, because a lot of the time trauma can show up in the pelvic floor, such as birth trauma, and dietitian is very, very useful sometimes with pelvic floor health. These muscles are mostly smooth muscle, but we've also got connective tissue in here, and connective tissue needs fuel from what we eat. After we have a baby, it can take the connective tissue up to 2 years to rebuild its original strength if it gets there. So what we eat really, really impacts the health of our pelvic floor as well. So instead of seeing a symptom as something to fix, I want to flip that around and consider it in a different way, that your body is actually a masterpiece and it works tirelessly for you day and night. And what these symptoms are a gentle nudge to say to you, look, something isn't right. So it's really a message from a loving place asking you to listen, treat yourself with tenderness and love, kind of like you would a small child. Personally, I'm 6 months postpartum, and I thought I really unconditionally love my body. But my body has been wreaking a wee bit of havoc with me lately. I'm finding it really difficult to lose weight this time, when I'm almost 2 stone heavier than I was before. And my first 2 babies, that was not an issue for me at all. It just naturally came off as I exercised, and I didn't care. I didn't actually, like, it wasn't a big deal. And also my pelvic floor is playing up a wee bit now, and I'm getting really cross about it. But actually, I grind it against it for the first few months. And I realized that I actually didn't love my body unconditionally. It was conditional. So basically, if you do everything right and you behave yourself and you're toned or whatever and you function normally, I'll love you. But I realized since that actually if it started playing up, I wasn't. The first time in my life I was getting a wee bit judgmental of myself and a wee bit ashamed of how my body was performing for me. So I've had to do a bit of self-work in the past few months and nurture myself and look at what's coming up for me there. So instead of asking your body what it needs, instead I think we need to ask our bodies what it needs without shame or judgment. And it really isn't the survival of the fittest, it's the survival of the nurtured. And instead of treating our bodies as machines to control, I think it's really important that we actually think of them instead as a wise being to trust. So this goes a wee bit better for the anatomy for some people. We're all kind of different learners. This is the back passage. So we'll be turning this wee machine sideways. Sorry, this wee pelvic model sideways. This is the rectum, the back passage. This is a side view. This is the connective tissue and the muscle in between the back passage and the vagina. This is the vaginal canal here then. So this is the entrance to the vagina. I call this the hallway. So you're walking up the hall. This is the vagina, which is about 8 to 10 centimeters in length on average. Can everybody see the wee cursor going up and down? Just give me a wee thumbs up if you can see the cursor. Yeah, okay. So it's about 8 to 10 centimeters long. So up this hallway. And the doorway basically into the womb is the cervix. So sometimes women will say, oh, I don't want to use a pessary, or I'm scared a tampon will get lost, but there's no way anything you insert into your vagina can go up into your womb, because we have this really structure here, kind of like a donut with a wee pinprick in the middle, and it stays nice and tight and closed for us. Dilates obviously up to 10 centimeters for vaginal childbirth, and that takes you up into the womb here. Then in front of the vagina, we have another wee bit of fibrous tissue here, more connective tissue and muscle. And then we have the urethra, which takes us up into the bladder. That's our pubic bone at the front and then the tailbone at the back. So it's in a survey, most women still think that we've only got 2 entrances into the body. I know when I went to uni, lots of people in my class thought that we peed out of our vaginas. So it's really common that women don't know their own anatomy. I certainly didn't when I started this work. Then if you look at this model, and that's kind of looking at the pelvis lying down, you can see you've got your back passage here. You've got the perineum, which is in between the vagina and the back passage. And then you've got your urethra up here, and then the clitoris is up ahead. It's not labeled here. So all these muscles here, which extend from the pubic bone out to the sit bone over here, down to the tailbone, up to the other sit bone, which is kind of where you feel yourself sitting if you wiggle side to side, and back up to the pubic bone. So it's kind of like a diamond shape. It's like a trampoline, so it's 3D. The vulva, which most people think your vagina is your vulva, but actually your vulva is the clitoris, the vaginal opening, and then the labia, which are around the vagina. Well, so we're going to break this up a wee bit. We're going to do a wee seated meditation now. I'm going to stop sharing this just for 2 ticks. Can you see me on the big screen now? Yeah, okay. So before we go into the wee seated meditation, we're just going to sit upright, either on the floor or in a sort of firmish chair. So for purposes of the wee meditation, your pubic bone, which is at the front, which if you slide your hand down from your belly button and you feel a bone, that's your pubic bone. The sit bone on the right is going to be 3 o'clock. So you know that wee hard part on your hip if you wiggle side to side. Your tailbone 6 o'clock. Don't worry, I'll talk through this as we go. And your other sitting bone is 9 o'clock. So it's basically the clock, and we're going to go clockwise to the right. And basically what I'm going to ask you to do is start at the pubic bone and then soften the muscles between 12 and 3 o'clock. Then come to the right sit bone and soften the muscles between the sit bone and the back passage. And we're going to continue that on around. So I'm going to talk you through it in a second. I'm going to go back to screen share. I'm just getting the message, you can't see the model when I was doing the thing. That's okay, but you can see it now. Got your tailbone, vagina, perineum. Sorry, I'm looking at this on the screen. Tailbone, back passage, perineum, vagina, urethra, clitoris. And I'm going to actually show you a model of the clitoris now, because when I go back onto screen sharing, you won't be able to see it. So with the clitoris, all we see is the tip of the iceberg. We just see the wee gland that's up here. Actually, did anybody know this is what a clitoris actually looks like? So you only see this wee end bit, okay, just above the urethra. But actually, this is the structure that's in underneath. And I just wanted to show that, because if I showed you a bladder or a kidney or a heart, you'd be able to recognize it immediately. But I'm not sure if anybody here actually has ever seen this before. Has anybody? Put it in the chat if you have a wee thumbs up. I'm waiting for all these thumbs. Nobody? Isn't that crazy? So this is the only, I've researched and asked what is this function of this organ? And the only function of it is for pleasure. So there you go. Men don't have that because their structures are for multi-purpose. So I think that's pretty amazing. And it's really good to just actually know this and be proud of what our bodies do. So I'm gonna go through the wee seated meditation now. So I'm gonna go back to screen sharing. So if you all just take a wee seat. Actually, I'm not going to screen share because you don't need to see it if I'm talking you through it. So you can still see me, can't you? Yeah, okay. So we're going to just gently close our eyes where we are. And bring your awareness to your pelvis, just on the chair where you are there. And I want you just to think about soften the muscles as you take a nice inhale and let them relax and open up onto the chair. So we're going to bring our awareness to the pubic bone. And we're going to think of it as being the 12 o'clock. As we breathe in, we're going to melt the muscles between 12 o'clock and 3 o'clock. So 3 o'clock being the right side of your hip. So that we sit bone. So take a nice inhale, let the shoulders soften, let the jaw relax. Let the muscles melt onto the chair. Let the feet soften down into the earth. Bringing your awareness now to the sit bone on your right and your back passage. We're going to soften and melt the muscles into the chair between 3 and 6 o'clock. So let those muscles melt into the chair. Invite the shoulders to soften away from the ears. Bringing your awareness now to the muscles between the back passage and the left sit bone at 9 o'clock. As you breathe in, let the muscles soften and melt into the chair. Most of us hold tension in our pelvic floor muscles. That's a really lovely way to let them relax and soften. Bringing your awareness to the muscles now between 9 and 12 o'clock. So the left sit bone back to the pubic bone. Deep breath in. Exhale, let the muscles relax and soften. So now the muscles are completely relaxed. We're going to initiate a pelvic floor contraction. So I'm going to do this a wee bit differently. Normally the cues we would use are squeeze the back passage, hold in urine, suck up a tampon, hold in wind. But I want you to visualize that canal, the vaginal canal. So at the entrance, right up to the womb, up to the cervix. So it's about 8 to 10 centimeters long. And I want you to split it into two. So I want you to work with the lower half, so the entrance up halfway. And I want you to squeeze and lift up the lower half of that vagina. So the bottom part of the hallway is getting squeezed and lifted up. And then inhale, let go. Lovely. Exhale, squeeze and lift the lower part of the vaginal canal. Inhale, let go. And once more. Exhale, squeeze and lift. Inhale, let go. Don't worry if you can't feel a squeeze, release if you're completely lost. That's really common. Now we're going to go to the top half of the vaginal canal, so that's halfway in and just between up to the cervix. So the top half of the hallway now, we're going to squeeze and lift. Inhale, let go. Exhale, squeeze and lift. Inhale, let go. Exhale, squeeze and lift. Inhale, let go. Now let's squeeze the whole hall. So from the entrance all the way up to the cervix. Exhale and squeeze all the way up. As you squeeze, I want you to visualize drawing in energy into your body. And as you exhale and let go, I want you to release any tension. Lovely. Squeeze and lift, draw in energy. Now inhale, let go. Exhale, squeeze and lift. And inhale, let go. So I'll let you open your eyes now. So just type in anything if you felt anything with that. Did you know, did it make sense? Or were you able to feel a contraction? Were you able to relax? Did it feel new? Or did you not feel any connection to that area? Did it feel numb or weak? Could you not hold it really? Or, anything at all? Tell me, just let me know if you felt anything or what it felt like. Yeah. And that's really common. People find that it's hard to contract as you breathe out. And I'm going to talk about that later on. Yeah. I think we get into a cycle where actually the natural, and hard to hold, hard to isolate. Yeah. That's okay if you find it hard to isolate because they actually should come in together. So that's actually quite a nice thing. Find it hard to tighten. Yeah, and really relaxation of the pelvic floor is the most difficult. 75% of women are unable to relax. Yeah, up and down the hallway. And that's okay if you can't separate it. They probably should feed into each other. I just want to try it in a different way, hard to hold. So if you find it hard to hold, the endurance of the muscles is reduced. And definitely a top half more difficult. We can't see these parts of our body. Like if you haven't looked at the external, it's really difficult to visualize the internal. And that mind-body connection is really important, which I'll talk about later, is about actually looking at our body parts, getting a handheld mirror down there and actually seeing what's normal and doing a pelvic floor squeeze as you look down below. That's right for lower section. Yeah, lower section felt easier. So all different feedback there. So I'm going to go back to sharing the screen again. And you can all see the full screen now again. Yeah. So we talk about Kegels a lot. Kegel, Kegel, Kegel. Go to a pelvic health physio, give you Kegels. I can say that's literally like 2 or 3% of what we do. Often we're doing the absolute opposite. We're down training and getting the pelvic floor muscles to relax. The important thing is that you can contract fully, kind of think about your elbow. You can squeeze and contract, and you must be able to let go fully. And you must be able to control the letting go. That's called eccentric control. Mostly women are sitting around here. So they're in no man's land. And then you need your pelvic floor to kind of help you out when you're going to cough or sneeze. It's nowhere to go. There's no room because it's already held in tension. And then if you need it to let go, to do a pee or a poo or have intercourse, it's like, oh, I don't want to let go because I never hang out down here. So it's really common to get into a pattern where you're tense, and that's all connected with your breathing, which we're going to practice later. Our lives are so busy now that we do tend to be in a state where we're not letting the pelvic floor muscles go as we inhale, and that's a natural pattern that we were born with, as we would naturally inhale, let those muscles go, and exhale, they very gently contract. So we're in a very rushed culture now where we're in no man's land. We're breathing quickly and we're not getting the breath right down into the tummy. And then that's a whole knock-on effect. So it's importance of letting go, being able to contract, being able to release, and there's other cues that are in the wee talk there, but basically you want to build a connection. Whatever cue works best for you, you just need to build the connection. There's a wee squeezy app that you can download. It's $2.99. It's an NHS app. I think they have actually added in how to down train the pelvic floor now, so you can check that out. And what they generally would encourage is that you do 10-second holds for 10 seconds, or sorry, 10 times. So squeeze and lift like we just practiced, but hold for 10 seconds, then relax fully for 10 seconds. So that's your slow squeezes here. Do that 10 times. Your fast squeezes, which are the fast twitch fibers of the pelvic floor, you need them to prevent incontinence with cough and sneeze and laugh and running. That's where you contract as hard as you can and let go completely. But often I find women just need to build the connection first, see what's happening, and make sure they can relax them fully before we ever go to strengthening. So these are all the symptoms of misalignment of the pelvic floor and pelvic health. So prolapse, which is where the muscles can, or the structures of the organs can descend down into the vaginal canal, so your bladder, your bowel, uterus. We can have urinary or fecal frequency where we're running to the toilet loads and we can't hold on and we're having leakage. Diastasis, which is a really common condition where we get widening of the connective tissue, which is basically between the two muscle groups in the tummy. Low back pain, tummy pain, vulvar dryness, so dryness around the vulva, itching. Often it's due to dryness, due to hormonal changes, say postpartum, breastfeeding, menopause. Another big thing is we've been missold this information that we should smell like roses around our pelvic floor. But actually most of us would be allergic to all the commercial soaps that are out there, and they wash away really vital secretions that are in and around the vagina, and they actually protect us from infection. When we're washing those away with soaps and things, they actually are detrimental to our pelvic health. So the womb itself is self-cleaning, and pretty much so is the whole vulva, back passage, vagina. It literally just needs water, like nothing fancy. Or sometimes there's a Sanex 0% soap, anything with 0% in it. Repeated thrush is another big one, but actually repeated thrush is very rare, and it needs properly investigated to what the root cause is. And very rarely dryness and itching can be a sign of vulvar cancer. Another thing, and we don't talk about any of these things when you're out and about or chatting, is vaginal flatulence. So basically wind coming out of the vagina, and that can be really common with a tight pelvic floor. It's really common in young athletes and after babies too, for the first at least 6 months. Any sexual dysfunction, so pain on insertion or deep pain, feeling of looseness, reduced sensation, lack of orgasm or unable to orgasm. So 20% of women have never been able to orgasm. Any pelvic pain, so endometriosis, interstitial cystitis, any painful periods, Basically, all these things are called signs of pelvic health issues. Constipation, which is associated with fissures and hemorrhoids. So these are very, very, very common, but not normal. And often, as I said, we can have an overactive pelvic floor, which is hanging about in no man's land and really tight, but it's functionally weak. There's loads of reasons. So it can be altered breathing mechanics, fast pace of life, poor sleep, poor diet, lack of exercise, and a big one, which I find, is lack of adequate rehab and education. So education about how our body works, our anatomy, and lack of rehab after big events in our life, like onset after childbirth or menopause or abdominal surgery. So I'm going to chat a wee bit about bladder health. I realise I'm going to go about half an hour over, so I'll see how we get on. So we normally can hold around 500 mils in the bladder. The bladder is a muscle. I kind of describe it, if you can visualize a diffuser that goes like a pear, sorry, if you visualize a pear, once the fluid reaches up to the top of the pear, we get the urge to pee, and we should be able to empty the bladder fully. So it's normal to pee about 5 to 8 times a day and up to once overnight. But there are lots we're doing nowadays that can affect the bladder. So drinks can irritate the bladder. I've written in alcohol here, but sorry, further on down. It's also caffeine, fizzy drinks, citrus fruits like tomatoes. Urge urinary incontinence is where we get a really strong urge to pee, and then we're going and we're just doing wee tiny pees. There's nothing really there to speak about. And then there's also stress urinary incontinence, where we're leaking with high impact, like cough, sneeze, running. So basically anything that doesn't fit this first wee batch, where you just void normally, easy to empty, you don't have to stand up or wiggle or sit up and down, that's normal. Anything else is not normal. It's a really common myth that after we have babies, it's normal to leak urine, and it's absolutely not normal to leak urine. We kind of have made a joke out of it in the current culture. But I really don't think men would make a joke of it. So I do think it's got to do with this sort of lack of education about our own bodies and shame, and we kind of are covering it up with making it be a wee bit of a laugh, but it's absolutely not funny when it happens, and it does not feel nice. So I've talked about the elbow analogy. We must be able to relax fully and contract the pelvic floor, and we reduce the carrying capacity of the bladder when we go just in case. Oh, just wait, I'm going to pee because we're going to be in the car. Oh, I'm going to go pee. I'm going to go and tell your kids, oh, go pee before we leave the house. So don't do that because you're down training your you're down training the strength of your bladder. And also it concentrates the urine, it makes it more concentrated, and that actually in turn irritates the bladder. So doing that actually makes your bladder weaker. So tips then are basically reducing your irritants, and you'll find out yourself if you start to make a wee diary and become aware of anything can irritate your bladder. The urge urinary incontinence is really linked with brain retraining. So I often encourage women to use a wee distraction technique. If they feel the urge to go to the toilet and they've only kind of been 20 minutes ago and there was nothing to come out, tell yourself that and say, right, no, I'm going to distract myself. I'm going to do 10 squats and this urge will pass. And it normally does pass. It's just rebuilding that link with the bladder and the brain. So it pretty much is brain retraining, and let the urge pass. And once you start to do that, the urge will start to go away. The knack is a wee technique that we teach ladies who are having leaking with cough and sneeze. Sorry, I don't know why it keeps doing that. And that is basically to give those pelvic floor muscles a nice squeeze if you have time before you cough and sneeze. And that can close up the urethra, which literally has a wee sling of muscles around it. And if you do that and then cough and sneeze, you can prevent leaking. It takes 1 ml of urine to leak our entire underwear, and it really is a very, very, very refined process for us to maintain continence. So do not panic if you're leaking and you think this is awful, or there's so much wrong with my pelvic floor. It can be something really simple, and it can be normally the vast amount of things can be conservatively managed. Make sure you're drinking enough, because we tend to not drink enough, but as I said again, that irritates the bladder. So bowel health, we know 1 in 9 women have fecal incontinence, or sorry, general population, and it can be common after birth trauma. So we've had 3rd and 4th degree tears. It's associated with weak or tight pelvic floor muscles, pelvic organ prolapse, and constipation as well. A warning sign that you're on the way to getting fecal incontinence is you have poor difficulty controlling wind. So it's just really important to recognize those things in your body and go and get help and intervention. Physios literally have a toolbox that you would not believe. We have a gadget and a device to help with anything and everything. There's so much we can do. So optimal is 1 to 2 bowel motions per day. But actually in the guidelines would say 3 a day to 3 a week is normal. So anything in that range. But I don't really I think 3 a week is very, very little. It's not enough. And if you think of when you get rid of feces, you're detoxing your body every time. So I think 1 to 2 a day seems to be more functional and beneficial for our health. And they should be smooth and easy to pass. It's not normal to strain on the toilet. So squeezing, that's not normal. And irrespective of symptoms, bowel health is still vital for everyone, even if you don't have any symptoms. So constipation is not normal, and it's caused by often a lack of fibre, dehydration, and a big one for females, which I would say 85% of people do, is we hold in our tummies and we suck in. So we've got to that point where you're posing for the picture and we don't stop posing maybe. And again, I think that's just that stigma, but that we've been told we're supposed to have flat, concave tummies. If we look back at our ancestors, they certainly did not have concave stomachs. Their stomachs actually protruded outwards. And that's, I think, is actually what the normal female body looks like. Unless you can get to a point where you can really, after childbirth, definitely. But that suck and holding pattern, bracing, actually puts lots of pressure down through the pelvic floor muscles, leads to stool getting dried out in the bowel. And then when you finally do have to poo, it's so hard to get out that you're straining, you're constipated. So a nice place to start is putting your feet up on a wee footstool for bowel motion. So getting the knees higher than the hips. If you think of a wee potty stool, a toddler would use. So getting the feet up. What that does is unkinks the pelvic floor muscle. We should never have been on normal toilets. This was a mistake. And normal toilets are not basically designed for our bowel health. So get a wee stool in, a wee tiny stool, and just to get those knees higher than hips. Another nice thing to get the bowels moving early in the morning is looking at your diet. So we know flaxseed and kiwis and those things help, adding fibre, and hydration is a huge thing. So we're going to move on now to sexual function. So intercourse should never, ever, ever be painful, and it's known as dyspareunia. But it commonly can be, especially postpartum, around perimenopause or menopause, and certainly after certain cancer treatments. And it can be due to a variety of reasons. These are only the pelvic health physio reasons I'm talking about. There's lots more reasons, and basically anything I'm speaking about tonight, your GP is your first point of contact to rule out other reasons. I'm really just talking about reasons I would see and where more serious things have been ruled out. But mostly, it's due to vaginal dryness, tightness of the pelvic floor muscles, a hormonal imbalance. Commonly, the perineal tears, which can happen in childbirth between the vagina and the back passage, they often become thick and tender. So this can lead to pain at the entrance to the vagina. Then when we get deeper into the pelvic floor muscles, they can often be tight and overactive as well. So you can imagine how that's going to be painful. C-sections too, actually, most painful intercourse is with mothers with C-section births. And this can be often due to stiff scar tissue. It means the abdominal organs inside aren't able to glide up and down, and this can cause pain with penetration. So we can help you get to the root cause, and often we liaise with dietitians, because any pelvic health issue, there can be a nutrient deficiency or something going on with connective tissue, or lots of things. Like there's a very underdiagnosed condition, Ehlers-Danlos syndrome, which is where women are hypermobile. And if you're hypermobile in your joints and your tissues, obviously that affects your pelvic floor. Lots of other issues, loss of libido, lack of orgasm, reduced sensation. So we know with the menopause, we definitely have a reduction in the hormone called estrogen, and that can lead to vaginal dryness. And this also has a knock-on effect on the strength of the pelvic floor muscles, and it causes them to be weaker and lose their muscle bulk. So this is a vitally important time in a woman's life to focus on her global health. We know that this reduction in this hormone can lead to an increased risk of heart disease because it naturally increases our heart rate. So it's highly effective at this time to continue with exercise, especially loaded exercise at least twice a week, to maintain bone density and improve the muscle bulk. Books that I really signpost ladies who are going through the menopause are Jane Lewis's book, My Menopausal Vagina, and she's also on Instagram. And a really good pod set is called The Menopause Mindset. These wee things that I've talked about here are daily moisturizer and the lubricant for intercourse, and the local estrogen cream. I'll talk about those at the end when I stop screen sharing. I've got a few wee gadgets out here. Estrogen lubricant. Yep, okay, so I've got them all here. So periods. When we were at school, it was like we kind of dreaded our periods, and all of our friends like, oh, I got my period, I can't believe I got my period, it's so painful, and we dreaded it and we grinded against it. But the truth is, our periods in essence should not be overly painful. We should feel tired the first couple of days and have a mild lower abdominal pain, but they should actually be mostly pain-free. We hold lots of power and creativity when we tune into and work with our periods. We may notice some increase in pelvic floor issues around this time due to just a hormonal shift. And really what it's calling us to do is rest at certain times, so when we're actually bleeding. And the science is now backing this up. We notice that we can build 15% more muscle mass when we do strength training in the first half of our period, and along with resting in the second half, compared to strength training throughout our entire period. So 15% when we work with our bodies. Big corporate companies now are recognizing this. Ladies are more productive when they work in line with their periods. They're giving women days off when they're having their period, and they notice when they're in the first phase, the luteal phase, they're much more creative. There's a couple of books that are really good. There's Period Power. I can't remember who wrote that book. And there's a book by Laura Brydon, and I can't remember the name of that book, so my memory isn't good tonight, but I'm sure if you look those up, you'll be able to see. It's a whole world out there we weren't aware of. Well, I certainly wasn't. I'm going to touch on now a wee bit about prolapse. So prolapse is Latin, and it means to fall out of place, shift, slide forwards. And really what a prolapse is a soft tissue injury. And you can see up in the top corner here, the bladder is coming into the vagina. So that's called an anterior wall prolapse. So basically the connective tissue and the ligaments, something has gave way to allow this structure to move into the vagina. That's an anterior wall prolapse. A posterior wall prolapse is when the rectum shifts into the vagina. And a uterine prolapse is when the womb or uterus shifts down into the vagina. We can grade these from 1 to 4. And what they really are is a loss of tension or soft tissue injury. So 50% of women have a structural prolapse after childbirth, but we actually don't diagnose a prolapse until it's symptomatic. So it must be symptomatic to be diagnosed as a prolapse. So we'd say 4 to 6% have symptoms out of that 50%. There's lots of causes for a prolapse. We can have it pre-childbirth, high intensity sports. We're increased at risk after obviously having babies, perineal tears, the hormonal shifts around certain times in our life. We're breastfeeding after a menopause. We're also more at risk if we've got a kyphotic posture, which is basically a slouched mid-back. Oh, I keep doing that. High level sport without adequate core pelvic floor control. Bracing in the tummy puts you more at risk because you're squeezing and bracing, you're putting all the pressure down in the pelvic floor. Tight hips, stiffness in the lower back. We know the deep hip muscles are hugely involved in our pelvic floor strength. Altered breathing mechanics and weak and overactive pelvic floor muscles. So what you might feel if you have a prolapse, you might notice there's a bulge at the entrance to your vagina, feel like a tampon's falling out. You might have difficulty emptying the bladder or bowel, have low back pain or abdominal pain, feel dragging or heaviness in the pelvic floor with a prolonged walk or at the end of the day, or after high intensity exercise. So if you've been diagnosed with a prolapse and it's symptomatic, the first line of treatment recommended by the NICE guidelines is physio. And we can do so much. So pelvic floor muscle training is just one way thing we can do. We also have lots of things. We've got pessaries, which are basically tampons made out of silicone, which can put up inside to support the pelvic floor walls. Rehab, manual therapies where we insert the index finger into the vagina and release all those tight structures. So I'll show you the wee toolbox at the end that we use. So pelvic organ prolapse can be improved and even reversed with physio. And it can be graded from grade 1 to 4. Grade 1 and 2 is where it's inside the vagina, and grade 3 and 4 is where it's came down and outside of the vagina. So an individualized assessment and treatment is essential, and I personally use real-time ultrasound to guide the diagnosis. Surgery is obviously an option with any of these pelvic health conditions. So anterior wall prolapse, posterior wall prolapse, and often that can be taking a long time to get to, and often it can be a very positive thing for women to eventually choose surgery and to go down that path. And I would say the most important thing for surgery, and you're going to laugh, but it's that you like your surgeon, you get on well with them, you trust them. That's a massive component. All the evidence backs that up. And also that you definitely go to physio after, because the things that led to the prolapse don't go away. So the altered breathing, the posture, whatever it is, whatever fed into it. So it's really important to get help and go to physio after to help with rehabilitation. You absolutely need rehabilitation after any gynae surgery. And I mean any. If you're ever in hospital for, getting your appendix out, ask can you get referred to pelvic health physio. Diastasis, I'm not going to talk about this because I went way over. I'll send you this wee talk after. So basically, I feel like there's a missing link. There's a mind-body connection that we definitely don't talk about in the medical world. So physical symptoms can manifest as mental symptoms, mental health, and mental health can manifest as physical. And the truth is that everything is basically connected to everything. So our current culture is fast-paced, and we can become disconnected, and we can become disembodied, where we disconnect from our bodies. And signs of this is where we're constantly stressed, feeling overwhelmed, and feeling isolated, which means you're feeling stuck with lack of purpose, meaning. And what I've noticed in my work is that we definitely cannot strengthen the body that we cannot connect to. And we can't work on healing a body we don't love. And we can only do this through our senses, so the felt sense. So touch, look, listen to our voice and our body is telling us what to do, because mostly we know what to do. Movement. So movement practices where we can feel into our body. And we really want to switch off the chatter in our mind. So that new part of our brain that talks all the time, never gives over. That's only very, very new. It's the youngest part of our brain, and it does a wee bit too much talking. Once we shut that part of our brain down slightly, we can really get to know our bodies and work with our bodies. So reconnecting, I just wanted to show you the connection here. So you can see on the top right, everything's connected to everything. So look at the vocal cords and the vulva. See how similar this looks? And then look at the larynx, which is your throat, and the uterus, the track up to the uterus, which we just worked on. I'm going to, I'm going to take a wee break because it's 8 o'clock and I actually do not know how this happened. It's because I talked far too much. So stop screen sharing a second. I'm going to stop recording a wee second.